You know, as a chemist, it's actually hard to say this, but I think DMPK is actually one of the most important disciplines. I would say in any drug discovery project, we have potent compounds within the first month or two of starting a lead optimization campaign. And then we typically spend the next year and a half optimizing the drug metabolism parameters to get a compound that can successfully make it through IND-enabling studies and then be effective in man. Medicinal chemistry is really a central science for drug discovery. You know, everything rises or falls based on the quality of the molecules that are developed. We have to develop molecules that are stable, potent, engage the target, get to the right tissues. And we also have to be able to make molecules that never existed before. We have to be able to file novel patents and get composition of matter. So medicinal chemists are really the perfect blend of synthetic chemistry, molecular pharmacologists, drug metabolism scientists. Everything rolls together into medicinal chemistry to make a project successful. To really be successful in drug discovery, you have to be very open-minded, and you can't just be a chemist or a biologist. You have to become a drug discovery scientist, which means you have to interact with your colleagues daily. You have to really understand the assays. You have to have great rapport with your drug metabolism scientists. You have to constantly have interaction and refinement. It's probably one of the best examples of big team science there is, because no one discipline can drive a compound into the clinic. It requires 5 legs of the stool, and the best drug discovery scientists are well versed in all the disciplines. Drug discovery is a very big, complex field, and enzyme kinetics play a very key role in trying to understand residence time on your receptors and things like this. So having an appreciation for that and some expertise in that's very important. We can't always use animals for every study we want to do. Organs on a chip are a really nice surrogate in a lot of cases. That science is really maturing. And so if we can get a lot of our key in vitro and vivo correlations on an organ in a chip versus having to go to an animal, I think it's just very good to save animals. We don't need to use them.